So good afternoon, everybody. As Bill mentioned, my name's Natalie Bocking. I'm the Medical Officer of Health with Halliburton Kawartha Pine Ridge District Health Unit, and happy to provide this update on COVID-19 for the three geographic regions we support: Halliburton County, Northumberland County, and the City of Kawartha Lakes. My updates today are actually relatively short and hopefully also bringing some good news. From an EPI perspective, or regarding the numbers of COVID-19 across the region, we are seeing, I think, multiple indicators that things are improving and that COVID-19 transmission is decreasing. So I think something that we have been hesitant to say for sure, but I think we do have multiple indicators that are looking like it's moving in this direction, which really is a very welcome sign. Currently, we have 184 lab confirmed active cases. So I emphasized the lab confirmed component because these are individuals that have tested positive using the PCR tests. Our counts of active case numbers do not include people that might have a positive rapid antigen test at home or have symptoms and are presumed to have COVID at home. So this is just a reflection of lab confirmed cases. We have continued to have a decrease in the number of new lab confirmed cases reported each day. We were seeing greater than 100 new lab confirmed cases each day, and we're down to really 20 to 30 or so new cases coming through the lab each day. So moving in the right direction. Our test positivity has come down a little bit further, is at 9.6%. The last several weeks we were sitting at around 12%. So certainly an improvement. And also I think we have tended to have fared slightly better than some of our other neighboring health unit jurisdictions who are still seeing some test positivity in the high teens. So for our number to be less than 10, that's certainly moving in the right direction. The current number of outbreaks that we are following sits at 9, so also dramatic improvement. 6 of those outbreaks are at long-term care homes and retirement homes, and the other 3 in other congregate settings or hospital settings. A caveat to the numbers associated with outbreaks: we are only declaring outbreaks in highest risk settings, whereas before the Omicron wave, we would include outbreaks in community settings such as restaurants or hockey teams or whatever the case it may have been at that time. But now we are only reporting outbreaks in highest risk settings. So I think a caveat to that number as well. Interestingly, I think another indicator that we have been following that gives us a sense of overall general COVID-19 activity has also been broader absenteeism in schools. Now, we know that and there's been some media articles about this, that the overall absenteeism percentage does not necessarily mean that kids are either A, sick with COVID-19 or B, home with COVID-19. But we had wondered whether or not we would see schools with higher levels of absenteeism related to COVID-19. And according to the provincial guidance, we're planning to issue letters to be sent home with students should the school reach a certain threshold, so of 30% absenteeism. At this point in time, with schools having been back in class, in-person class for a couple of weeks now, out of the 60 publicly funded schools throughout HKPR, I understand that there's only 2 that we have actually had to issue absenteeism letters for. And again, that absenteeism number is not necessarily a direct reflection of COVID-19 activity, but the overall threshold had been met, so letters sent home. So I think reassuring that we really have not seen wider spread concerns related to absenteeism in schools, which quite happy to report. And then the last indicator I've commented on the last couple of weeks has been our wastewater surveillance data. So we do have 2 setups. So one measuring viral activity in the Lindsay area sewer shed, and the other measuring viral activity in the Cobourg sewer shed. Both of these as data as of last week had actually indicated a relatively significant decline in overall mean viral activity. So I think this is, again, leading to an overall much more optimistic picture. I'm quite hopeful that these trends will continue to be in the downwards direction. It's possible after some of the reopening and raised capacity limits that we've seen that we might see a bit of a plateau or a slight increase, but I don't anticipate we'll be going back to the very high numbers that we were seeing at the peak of this wave. So I think we should expect potentially a bit of plateauing, but I think, really kind of reassured in time to start seeing a bit of the light at the end of this tunnel related to this Omicron wave. I wanted to share a bit of data related to the impact of Omicron on, I guess, morbidity and mortality, specifically since January 1st. And really, I've been using January 1st as the date when we can be fairly confident that most of these numbers are directly related to Omicron variant as opposed to previous variants. We know that the Omicron variant really became the dominant variant by the third week of December, but that sometimes there's a lag between when we see its impact on hospital admissions and ICU admissions. So if we're looking at from January 1st onwards, so across HKPR region, we've had 59 residents that have been admitted to hospital with COVID-19 and presumably the Omicron variant. We have had 14 individuals that have required ICU admission. And unfortunately, we have had 23 deaths since January 1st of 2022 attributed to COVID-19. So the last couple of weeks, I've provided some further details just to give people a sense of I guess, the underlying risk factors associated with more severe illness associated with COVID-19. Certainly data from published studies, data from provincial numbers, and then local data continue to emphasize the role that vaccination has in helping to prevent serious illness associated with COVID-19 infection. If I look at our numbers associated with hospital admissions since January 1st, ICU admissions, and from deaths associated with COVID-19, the majority of these have been among individuals that have not been vaccinated at all. And so I think if really sharing these numbers to try and continue to encourage those individuals that have not sought vaccination as of yet to still do so. There's still plenty of opportunity, and to reassure and remind people that for those people that have been vaccinated, the important role that you have played in helping to prevent more serious outcomes associated with COVID-19 and to decrease the burden on our hospital system overall. We also know that individuals that are older and have other medical conditions are at higher risk of more severe illness. Certainly, almost 50% of the deaths associated with COVID-19 since January 1st have been among individuals that are age 80 and over. So 47.8%, I rounded it up to 50, so quite close to 50%. Among those admitted to hospital, we know that close to 58% have been over the age of 70. So certainly, I think local evidence that we are continuing what we know about COVID-19 to be true, in that people that are older are at higher risk of more severe outcomes associated with COVID-19. And then the other thing that we sometimes look at in terms of severe outcomes is our most vulnerable residents in our long-term care homes and retirement homes, because we know that in particular COVID-19 has had a disproportionate impact on the lives of the seniors in our communities. At this point in time, only 8.5% of hospital admissions have been from residents of long-term care homes across HKPR region. Again, that's since January 1st. However, unfortunately, we have had a number of deaths associated with residents of long-term care homes from the Omicron wave. And I understand that we're at a total of 10 deaths to date since January 1st of this year that are among residents of long-term care homes from COVID-19. So we certainly, I think, understand the Omicron variant to have a lower risk of severe illness. We are certainly not seeing the same extent of severe illness and death associated with COVID-19 as we did in the first wave, because we have vaccinations now and because we understand the virus better, and we've been able to put in layers of protections to help keep our most vulnerable community members safe. I think it does speak to, however, the need for cautious optimism, that while things are improving, it doesn't mean that we throw everything that we've learned to the wind and pretend that COVID's not here, because we know that this is not a benign virus. It's not mild, certainly by a long shot for a large number of people. And so we need to be aware of that and work together to protect our most vulnerable community members. I'll move to a couple quick updates about vaccination. So with regards to booster doses, so we know that a booster dose does improve protection against COVID-19, specifically severe outcomes and ICU admissions and death, and really the uptake of booster doses across the region and provincially, I think, has contributed to preventing hospital admissions, ICU admissions and death from Omicron. Among people aged 70 and over across HKPR, 84.5% have received their booster dose already, which is excellent news. Among people aged 50 and over, 72.3% have received their booster dose. And among people aged 18 and over, 59.4% have received their booster dose. I have spoken last week and indicated the week before that we have seen a very significant slowing in uptake of booster doses. I think those people that really, really wanted to get their booster doses certainly have. We have an ongoing trickle of folks that haven't gotten their booster dose yet, but are still interested. But we also do know there's a large proportion of people that could be getting their booster dose now that have not yet for various reasons. And I would encourage those people to seek out an opportunity to get vaccinated. Lots of opportunities and easy access. Among our pediatric population, or children aged 5 to 11, we're sitting at 47.4% having received their first dose of COVID-19 vaccine. And I'll speak in a couple minutes just to some initiatives to support improving access to vaccination for this age group. For access in general for COVID-19 vaccination across all health unit-led clinics, and we have a number of fixed site locations still across all 3 geographic regions. The clinics are open for walk-ins really at any time for any dose and for any age individual if you're eligible. There is both mRNA vaccines available at all of the clinics, and we'd encourage again anyone that hasn't had their booster to come on in. If you haven't had your first dose, then to really be looking to see where you can still get your first dose or your second dose, because this is still going to make a difference in our overall continued battle against COVID-19. Excuse me. We are similar to all other health units supporting school-based clinics for children aged 5 to 11 at schools across HKPR region. We continue to work with school boards and schools themselves to arrange the logistics for these clinics. A reminder to anybody listening, and certainly for the media, that any child that receives a vaccination at these school-based clinics does so only with parental consent. So consent forms have been sent home. I believe at almost every school now, we had a first wave and then a second wave of consent forms that was going out. And that consent form must be completed and returned to the school and then to the health unit for vaccination to take place. Our first school clinics will be held February the 11th, and I think we're looking forward to this kind of next chapter in improving vaccine access for this age group. And the only other comment I'll make regarding vaccinations, just in case there were some questions, there was an updated statement from the National Advisory Committee on Immunization regarding timing for COVID-19 vaccination following a COVID-19 infection. So I know we have had some questions previously about this. A reminder that the National Advisory Committee on Immunization, or NACI, will put out a recommendation based on their review of the data, review of other jurisdictions, and of the basic science behind vaccination. And so they'll put out their recommendations. It's then up to each province to determine what that looks like for actual policy implementation in the province. So at this point in time, we're still waiting to determine if there will be any change in provincial direction based on this most recent NACI statement. In the NACI statement, for those individuals that have recently had COVID-19 infection and would like to get a booster dose of vaccine, the NACI statement has recommended that people wait for 3 months before they get their booster dose. Now, there's a difference between when people are eligible to get their booster dose and when the optimal immune response might be for the timing of that booster dose. So the NACI statement is based on the optimal immune response timing for when the booster dose is following infection. People are eligible to get their booster dose after an infection, essentially as soon as they're out of isolation and they're feeling better. And so that decision of timing really depends on a number of different things, including what the local context is. So if we're seeing a very, very high number of infections and there's a concern for a risk of reinfection, then someone might choose not to wait the full 3 months and receive their booster dose earlier, despite the fact that you might get a better immune response if you waited for that 3-month window of time. So again, at this point in time, we're waiting for the provincial guidance, but I think certainly if people have any questions about that, we do have more information on our website. And really that guidance applies to those people with either a lab confirmed COVID-19 diagnosis or that have had a rapid antigen test that's positive for COVID-19. So I think I'll end my updates there, which will leave lots of time for questions. I know that we continue to follow our provincial framework for reopening and easing of public health restrictions, and the next date is February 21st, at which time the province will be easing further restrictions. And so I think we'll continue to follow things closely and ensure that we're in a position to respond should we need to, but I'm again quite pleased and happy to be able to share some more optimistic news today as we start to get out of this wave. So thanks, Bill. I will pass back to you and happy to answer questions.
Thanks, Dr. Bocking. Great information. And there may be another indicator of how serious COVID is based on the MOH's remarks during our weekly updates, the length of time that it goes. But anyways, we'll see about that. Our first question is from Dan. Go ahead, Dan, with your first question and follow up.
Thanks, Bill and Dr. Bucking. Yeah, first off, you mentioned the data from January 1st onwards. I guess knowing what we know now, I guess when a new variant shows up, I guess what happens to the previous variants, like Delta, for example? Do they go into hibernation or disappear, or I guess what does that affect?
Yeah, so it's interesting because essentially the new variant, if it has a competitive advantage over the other variants, so Omicron, its competitive advantage was it was much more infectious. So Omicron infected so many people really that the Delta variant no longer had the same pool of people to infect. And so it slowly kind of just disappears because there was nobody else that it could infect across our communities. So one way they refer to it is the new variant outcompetes the previous variants. And sometimes they do just totally disappear. Sometimes there might still be pockets, for example, in other areas of the globe where Omicron hasn't reached and Delta might still be there and might have an opportunity to circulate in other places. But more often than not, it just when it loses places to transmit to, it eventually just kind of disappears.
Okay. Yeah, and you mentioned some promising data with cases going down, I guess. But how important is it for people to still be vigilant with about the potential of any future variants? And what message do you have to people who might be maybe skeptical, knowing that they've heard optimistic reports before, and some sort of new variants have come up, I guess.
Yes, so I think that we don't know what's going to happen in the future. I think we have repeated the same cycle for the last couple of years where we make it through a wave, we come out the other side, we have a period of time where things are looking good, and then a new variant emerges. There's certainly nothing right now to indicate that COVID's done. I think we will continue to see COVID, but the key is how we're able to manage COVID infections across the community and to minimize its impact on our acute care system, our healthcare system, so that we don't have to cancel surgeries or limit other health services. I think it's important, I think, to celebrate the small wins that we have and to be able to ease public health restrictions and hopefully look forward to a time where we won't need public health restrictions because we'll be managing COVID-19 on an ongoing basis and it doesn't require drastic measures to prevent our acute care system from becoming overwhelmed. I do think that we need to highlight and recognize the sacrifices that people have made in order to really ride this Omicron wave. So we know that the restrictions, as challenging and as hard as they are, do help to slow transmission of COVID-19 down, which does help prevent hospital admissions, ICU admissions, and death. And so people have all made sacrifices to help the collective good and help protect our community members. So sorry, Dan, you got a really long-winded answer there, but I think there's some things to celebrate that we've done well, some things to learn, and some things to look forward to.
Perfect, and no worries. It's always good to have more information. So thank you.
Thanks, Dan. Sam, you have some questions? Go ahead.
Yeah, thank you, Dr. Bocking. Currently, I guess in Ottawa and in other areas around the region, I'm thinking of Minden last weekend. We're seeing a lot of misinformation, or at least, an amplification of the hostility towards some of these, foundational practices that we've all done over the past couple of years, even including like mask wearing, as well as vaccination rules. Could you offer some thoughts on that? How you respond to, some of this misinformation, and as you as a health unit are kind of combating maybe some of these assertions that people are making about the efficacy of these measures?
Mm-hmm, mm-hmm. So, I mean, I think that it's fair to say that there are a lot of people that are very frustrated. And I think it's fair to be frustrated. The pandemic has had, challenged everybody in many ways. And the measures that have had to be taken are hard. And they're hard for everybody, including public health units. It, and so I think it's been a long enough period of time with enough frustration that when we start to see easy avenues for some of the frustration to come out, then it will come out. And I think that I hope that people will continue, if they are frustrated, to be respectful and to do so in an appropriate way if they're sharing kind of their opinion. I think if we look to the science around COVID-19, we do have good data and good evidence globally of the effectiveness of A, vaccination, B, masking, and C, some of the other more restrictive measures that have gone into place, such as capacity limits or limits on social gatherings. And so for me, from a science perspective, we do have very good data to support that. And as hard as it is, we know that those measures have actually saved lives and have enabled our health systems to survive this and continue this. So I hope that people will continue to look at the sources of information they receive and not rely solely on social media for these sources, and to I think be realistic and recognize, yes, I'm frustrated, but let's look at the reality of what we have accomplished and been able to do.
Perfect. And just a short follow-up. If someone's kind of coming into contact with people that have these views or are challenging some of these facts, do you have any tips for how to communicate information to people who might be, vaccine hostile or kind of reject the science behind masks, etc.? How can you kind of communicate that well to friends and family, maybe?
Yeah, and I guess the key to those discussions is timing, and a protest or demonstration might not be the right place to engage with individuals about sources of information or what their understanding is. I think those settings are often just heightened energy, anxiety, temperatures to start with. I think the key is with kind of trusted friends and family. And one of the, I think, fundamental principles is approaching it with respect and understanding that people will have different opinions, but to also then share the facts and what we do know. To listen, to try and understand, but then again, come back to the facts and share what we do know, and look at the evidence of the impact that these measures have had.
Perfect. Thank you very much.
Thanks, Sam. Katrina, go ahead with your questions.
Hi, Dr. Bocking. As always, thank you for the update and for making yourself available on this Wednesday. My first question is about the school clinics. I believe you said the first one is set for the 11th, which would be Friday. I'm just wondering what the feedback from parents has been as far as signing off on the vaccines, and how many schools are set to hold clinics at this point.
So I don't have an exact number for you. I know that our team, together with the school boards, had originally had an initial list of schools based on current vaccination coverage data. So those schools that had lower coverage, ensuring that we offered clinics at those schools. But as we get consent forms back from parents, we are adding additional school clinics on. So I don't have an exact number right now to share with you in terms of the number of schools that will have clinics. I think the uptake, we've actually been pleasantly surprised that we have had, I would say, relatively good uptake from parents returning consent forms where they do support vaccination through these clinics, and have consented and asked for their child to be vaccinated there. And so really pleased to see that.
Okay, my next question is about Paxlovid. PRHC made an announcement yesterday that they're teaming up with Lake Ridge Health to make it accessible for people in the Peterborough region. I'm wondering if Paxlovid is available for the HKPR region yet, and if not, when we could see it.
Yeah, so good question. So the province is really taking a phased approach to rolling out Paxlovid through different assessment centers and clinical assessment centers. And I think logically have made them available first at more tertiary centers. So that means that more rural regions like HKPR will likely see their introduction later. At this point in time, I have not been made aware that it's currently or likely to be available at any of the sites across HKPR in the imminent future. I think Peterborough will likely be the closest place. But again, I know the province in their kind of phased in approach is looking at making it as widely available through these assessment centers as they can. It is still a relatively small number of doses of like looking at the province overall. So I think they're trying to be strategic about that. But I also, I think further to that, hospitals and assessment centers putting in place mechanisms so that if they have an individual that is eligible and would fit kind of the criteria that they would really benefit from Paxlovid, that there's a way, even if it's not at that center, they might be able to access it from someplace else.
Okay, thank you so much.
Thanks, Katrina. Is there anybody else with questions? I thought I saw a hand before, but that disappeared. Is there any other questions any members of the media have, or on the nothing in the chat box?
Can I follow up on the last question I just asked?
Sure, Katrina. Yeah, it's open. Go ahead.
Okay, so with regards to Paxlovid, is there a system in place now that if someone from HKPR needed it, could they go to PRHC and get it? Is that laid out yet?
So I don't actually know 100%, and I don't want to give you inaccurate information. I'll double check with our clinical colleagues. Just it's run outside of the health unit. It would be through our area hospitals. But my understanding from provincial calls is that they were looking at those mechanisms. So I would anticipate that if someone really fit that criteria and would benefit from it, that there would be a mechanism in place to be able to access it.
Okay, thank you so much.
Okay, thanks, Katrina. Is there anybody have any more questions? This is kind of like the vaccine. We were doing appointments and now it's walk-ins and it's wide open. So I guess there not being any, again, a direct correlation between the length of these sessions and the activity of COVID. So thank you everyone for joining us. Thank you as always, Dr. Bocking, for the great update. Lots of good information. We will do this again in 7 days' time. Until then, have a great rest of the week, and we appreciate you joining us and helping us share the information.
Thanks very much, everyone. Take care.